feature of enteric fever. Let's discuss about the clinical feature of enteric fever. The incubation period of enteric fever is 10 to 14 days. Onset is insidious. Prominent clinical scenario of enteric fever is fever associated with headache, associated with abdominal abnormalities. These three clinical scenarios. First, the prominent sign and the first prominent symptoms is a fever. Everybody we know about fever. How fever happen? What is the cause of fever? There must be the factor 1, infection. Second, inflammation. Third, there must be clotting. Fourth, rise or fall in temperature. In case of fever, every fever is tachycardia. But in case of enteric fever, it's a bradycardia. So let's something know about what is tachycardia, what is bradycardia. Before we discuss tachycardia and bradycardia, we first know about what is pulse rate, what is the normal limiter for pulse rate. Pulse rate, the normal definition is the pressure exerted on arterial wall is said to be pulse rate, and the normal pulse rate is 60 to 100 beats per minute. When it is more than 100 beats per minute, it's said to be tachycardia. Everybody we know. And when it's less than 60 beats per minute, it's said to be bradycardia. So in case of enteric fever, we often see the fever is relative bradycardia. It's a step ladder fever first. Second, it's a relative bradycardia. The fever occurred due to Salmonella typhi directly triggered to the lymphoid tissue of a small intestine, resulting a typical lesion in lymphoid cells is said to be Pierce patches. So where does Pierce patches localize? Pierce patches localize the lymphoid cells of a small intestine. And the second prominent feature is headache. Why headache happen? Due to the Salmonella typhi directly triggers to the intestine, the gastric mucosa secrete H ion, and that initiate our cerebrum. So headaches does occur. And the most prominent clinical scenario is abdominal abnormalities. So in case of abdominal abnormality, the patient may feel it's a diarrhea. Might be patient feel constipation. Might be patient feel anorexia, means loss of appetite. And might be patient feel nausea and vomiting. Other sign includes mileage, joint pain and arthralgia, drowsiness and etching of limb. In case of enteric fever, the first week, what the patient feels? Patient feels fever associated with headache, associated with abdominal abnormalities. Might be diarrhea, might be constipation, might be vomiting, might be anorexia. And one plus more sign is myalgia. The end of first week, what the patient feel? Rose spot on trunk and abdominal distension, upper respiratory tract infection, especially cough, diarrhea and splenomegaly. Second stage, complication, it's a bowel. Bowel is either perforated or hemorrhage. Perforation happens. Intestinal clotting happens, intestinal hemorrhage happens, intestinal obstructions happen. Whether the patient may feel cholelithiasis or cholecystitis, infection or inflammation in the gallbladder. We may feel splenomegaly. In kidney, we may can see glomerular nephritis, or we can say nephritis. We already know about nephritis. The most prominent sign is RBC cast present. Liver abnormalities, upper respiratory tract infection in case of second stage complication, upper respiratory tract infection, might we feels bronchitis and arthralgia, joint pain, bone and joint pain. The last stage of enteric fever is a little bit very complicated. It bleeds myocarditis and delirium, means mental abnormalities, and the patient goes to coma, and if untreated the patient may demise, means death.